The technology is fast moving. From next week, testing for coronavirus in the UK will be easier than ever. Less invasive, with no need for a health professional to administer them, 5.8 million on-the-spot tests will be using DNA alongside 450,000 swab samples. And rather than the current 1 to 2 day wait, the results are known within an hour and a half.
We can expand testing capacity further and into settings where, for instance, in schools currently we have survey testing, so we have some testing that would be able to be expanded, but also looking across the community where we want to test people who don't have symptoms to find out where the virus is.
The testing system itself is complex and reliant on multiple supply chains to source the products, but it's hoped that it could open up a new phase in mass testing across the country. These tests could signify a game-changing moment. Not only will they be able to be carried out by practically anyone, but they can also detect seasonal flu. Meanwhile, those behind the testing say that controls are being put in place so as they can avoid any false negatives. Britain had come under severe criticism at the start of the pandemic. The government was blamed for being too slow to go into lockdown, too lax in testing, and had failed to get a successful track and trace system up and running. And despite promising leads in its bid to find a vaccine, recent regional surges in the UK and the rest of Europe are a warning that the pandemic is nowhere near over.
There is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating and treating patients, and tracing and quarantining their contacts.
The message more or less the same as it was at the start of the pandemic. The basic prevention measures are as crucial as ever, as governments try to stamp out rising infection rates to avoid the full lockdowns that have crippled economies around the world. Sonia Gallego, Al Jazeera, London.